And we're back on the Liberal Oasis radio show. This is Bill Scher. You can always hear these shows at LiberalOasis.com, videocast and audio podcasts, always on WHMP News, Information, and the Arts. We are with Roger Hickey, co-director of Campaign for America's Future. Happens to be the man that signs my paychecks during the rest of the week. But I'm off the clock today, Roger, so you get my full fury. No holds barred.
Just fire away, and I would refer people to our future.org to get Bill's great blogging on our website.
Thank you very much. So let's talk about healthcare and the presidential candidates. It seems like we have the most detailed, comprehensive healthcare proposals from a presidential field this early in a race in recent memory. Why do you think that is?
It's a great thing about democracy, Bill. The candidates have to go out and talk to the voters, especially in a primary election. They also take polling. Their experts go out and call people. And what they're getting back is the American people want to hear solutions to the healthcare crisis. And so there's been a kind of virtuous competition, especially on the Democratic side, where all the candidates are striving to explain clearly and simply how they would cover everybody in America. So it's been a good, very useful primary season, and each candidate, especially Edwards, set the pace early on, and then Obama, and then Hillary. They all have a very good comprehensive health care plan.
So what are the core elements of those three plans, and are there any key differences of those plans that people should be aware of?
Well, all of them, first of all, aim to cover everybody and to get a handle on the cost of health care. All of them build on the existing, although eroding, system of health care through employers, but would take the burden off of employers by offering them a choice. And choice is the big word here. Employers have a choice of continuing to cover their employees or to pay into a fund, a public fund that would cover everybody. Individuals, if they like what they have now, as Harry and Louise seem to have done in the last round, they get to keep what they've got, stay with their private insurance. But if they don't like it, they have the option, or their employers have the option of buying into a public plan similar to what Congress gets. And one of the plans, in addition to a lot of private health care plans, is a public plan like Medicare. So it's choice is the big word, and yet all of these plans would have to meet certain minimum standards for decent benefits and low premiums.
Are we seeing similar strong plans from other Democrats in the field, from Joe Biden, Bill Richardson, Chris Dodd, or Dennis Kucinich?
Well, most of the people that you just mentioned are sort of coming along behind. They're not too detailed in their proposals. The big exception, of course, is Dennis Kucinich, who, as everybody has heard, has a plan, the Conyers-Kucinich bill, for universal single-payer health care plan, nonprofit health care. He would basically outlaw the private insurance companies from the basic job of insuring people. And so Dennis Kucinich is also exerting pressure on this public debate about health care.
So what do you say to a liberal voter who is concerned about health care? They've seen Sicko. They diagnose that the problem is private insurance that's putting profits before health care. Why should they not say Dennis Kucinich is the only guy that is going to get private insurance out of this business altogether? Why should they accept a plan from Clinton or Edwards or Obama that's still going to keep private insurance in the game in some capacity?
Well, I would say that basically Kucinich's key insight is right. If we had one plan that everybody was a part of, one public payer that was in charge of all health care, we'd have a more efficient system. My problem and the problem of all the other candidates is that's a hard political thing to accomplish. Basically, putting the private insurance companies out of business for basic health insurance. And so I think, given the mix of politics today, establishing a fundamental guarantee that everybody will be covered and that prices will be kept under control is a first step toward the vision that people like Dennis Kucinich and his backers are putting forward. If Dennis Kucinich had a chance at all of being president of the United States, then that would be a different country that we lived in right now.
Well,
his supporters are putting pressure on all of the candidates to be tough on the health insurance industry and to have a public plan as at least an option.
Is it politically difficult just because that private insurance has so much money? Because some might argue, look, they're going to fight you no matter what you do. So why not go for the gold, go for the big single-payer plan if you're going to have a big fight anyway?
Well, I think the answer is that the insurance companies are going to be a problem in getting this passed. If we were trying to put them out of business entirely, they would be even more of a problem. But that's not the only issue. Political reality is that a lot of Americans in the system that we've evolved over many, many years like the health care plans that they have. They like the fact that their employer buys them a pretty good plan, and they've negotiated that in collective bargaining. And as we saw the last time Hillary tried, people get very, very nervous when you say you're going to be put into a government plan if they don't know what that looks like. So part of political reality is that we want to give people the freedom to stay right where they are if they like it, but to gradually over time have the option, especially if they need it, to go into a publicly run system. And my reading of political reality is that's the best we can aim for, and it would be a major change in the healthcare system.
Now, there's all this talk at the grassroots level that we need to do something about healthcare. We've seen the Democratic field respond to that. Has the Republican field responded to that in any way?
It's weird. It's very, very weird. The Republicans know that they have to say something about healthcare because they're reading the same polls, but their ideology simply prohibits them from doing anything practical. So that one after another, they all seem to echo the Bush position, which is we'll give people a tax cut and take away the tax break that employers now have, throwing the whole system into chaos. And people on their own with this tax cut, if they're lucky enough to get one, will be able to buy health care on their own as individuals or families. That just doesn't pass the laugh test, given the fact that private health insurance for a family is in the $13,000 range per year. It's classic right-wing Republican ideology, and it's so strong in the Republican Party that even Mitt Romney, who actually had a more ambitious health care plan in Massachusetts, you all know about that, is running away from that kind of weak tea health care plan in Massachusetts and is simply talking about tax cuts. So
it seemed to be that his campaign was going to be based upon his ability to bring parties together and pass universal health care. Why do you think that has changed?
The power of the right-wing Republican movement in the Republican Party forces these guys or makes them think that they can't sell a realistic plan. American politics has changed dramatically since people like Bob Dole and other Republicans felt that they had to try to put forward serious health care plans. Even George Bush's father had a health care plan which is much more focused on reality than these guys. So it's ideology pure and simple.